Hi, I'm Dr. Todd Shatkin, and welcome to this Monday Morning Minute. Today I want to talk to you about the Shatkin F.I.R.S.T surgical guide stents. We've been making surgical guides since 2003 for our doctors for all different purposes, for denture stabilization, for single teeth, multiple teeth, roundhouse bridges, everything in between. And the reason we've been doing that is to help hold your hands during surgery. When we first started Shatkin F.I.R.S.T back in 2003, my father, Samuel Shatkin Sr., DDS MD, said the only way he's going to be involved with Shatkin F.I.R.S.T is if we can hold the hands of the dentist and make sure they have the same high success rate with their cases that I've had over the years. And back then I was having around 95% success rate, which I'm still having to this day. And the way we help hold your hand is you send in your x-rays. If it's a CT, great. You send in your models, and we plan the case on the model and on the computer with a CT guide. Once we make the plan, we then print a 3D model on a digital printer. Now, of course, in 2003, we were doing these on stone models. There was no such thing as a CT scan or a cone beam scan, and we were doing them manually, and they were working out really, really well. But now we're in the next decade, right? 2 decades later, we're doing CT guided stents. We're making 3D models, and then we're fabricating the surgical guide to go over that model so that it's a very, very precise, very precision surgical guide stent. What we're doing is we're positioning the implant in a 3D axis within the bone on your CT. So when you send in your cone beam CT, and it doesn't matter what manufacturer the cone beam CT machine is, because we use Blue Sky Bio and we merge the CT scan that you send us with the either digital impression or a regular stone model impression that you send to us, or an impression. So we pour it up and we scan it and we merge the two together digitally so that we can overlap the x-ray scan with your model. Then either Dr. Dave Powers or myself will plan the case, put the implant analogs in the digital platform, and then we print this 3D model. So it's a very, very precise plan. If you look here, you'll see this is a very, very thin ridge. Extremely thin ridge on this particular case, but we were able to get 6 mini implants planned for this particular upper denture case. Okay, and then what we do is our lab will then make a surgical guide stent over that, and it'll come out looking something like this when it's all done. Then what we do is we disinfect it, clean it, and package it into a nice sterile sleeve. This will come to you all ready to go. All you have to do is take this out of the sleeve and use it in the patient's mouth. Now we also have our drill guide instrument. And our drill guide instrument comes in 3 different sizes. We have the silver, the gold, and the blue. And the reason for 3 different sizes is the silver is for the 1.2 pilot drill. We use the silver guide for our 2.0 and our 2.5 MDL implants. The gold one is for our 3.0 Milo implants. This is for a 1.5 pilot drill. And the blue drill guide is for a 2.0 pilot drill, which we use for our larger implants. Okay, so that's the reason for the different size pilot drills, and you will have corresponding titanium sleeves that match the size of the drill guide. So in this case, a 1.5 drill will then go into this pilot drill guide instrument to position the pilot hole right in the middle of the stent sleeve. And all of you should know this. I'm sure if you've come to my course, you've seen us use these. This is how it works. But the whole point of my discussion today is to encourage you to use the 3D surgical guides. And the reason is not just because it's going to help you position the implants perfectly, but we're at a point in time where medical legally, surgical guide stents are pretty much standard of care for dental implants. And we started this a long time ago, but we're at that point now where I feel like if you're not using surgical guides, it could get you into a situation if you have a problem. I think one of the things that a competent attorney is going to ask is, how did you plan the case, doctor? And did you use a surgical guide stent? And was it a 3D surgical guide stent, or was it a 2D surgical guide stent? So that begs the question, how many of you have cone beam CT machines in your office? I think now a large number of you do, but there's still some of you who are still using panoramic or intraoral x-rays. So I would also encourage you to consider buying yourself a cone beam CT. Now, Shatkin F.I.R.S.T sells the Genere 3D machine, and it's a wonderful, wonderful machine. We've been using it now in our office for, I think, almost 9 years. So it's really a great machine, and if you're looking and you're on the market for a cone beam CT, speak to one of our salespeople about the cone beam CT machine that we sell from Genere. It is a very reasonably priced machine, and it's excellent. I do probably 20 scans a day every single day in our office, and it's a workhorse. It works really, really well. But regardless of that, if you don't have one, you really should think about getting one, and then you can upload those cone beam scans right to our portal, and we can make your CT guided stents. You can also upload your digital impressions if you have a digital impression scanner. You don't even have to send models or impressions in the mail. You can send it all digitally. It'll save a couple of days shipping. So that's my message to you today on this Monday Morning Minute. Get going with CT guided stents at Shatkin F.I.R.S.T. You're going to love it, and you're going to have excellent results. I'll see you next week on the Monday Morning Minute.
Thank you, Dr. Shatkin. Anyone who needs a 3D machine, we have the Genere Papaya 2D/3D machine, and it is an absolute phenomenal machine. Dr. Shatkin liked it so much that he has 2 of them in his office now. And I know that we have over 70 doctors throughout the country that are enjoying this technology. So keep in mind that the Genere, it's very affordable. We offer financing, and anyone who purchases the Genere gets 3 months of CT guided stents at no charge. So Shatkin F.I.R.S.T is all about education. And I wanted to let everyone know that there is an International Academy of Mini Dental Implants Facebook page. And this Facebook page, if you haven't been there, please go and explore it. Take a look at it and post your cases. It's educational. It's only for dentists, and dentists that have much experience can chime in and help you with your case. So I know that a lot of our doctors are posting cases, and it's an absolute great way to understand the cases better and get other points of view on it. So if you haven't been to our Facebook page yet, please get to our Facebook page, post some cases. It's the International Academy of Mini Dental Implants, and you'll find it on Facebook. So join us as soon as possible. I think you're going to really find that educational. And I like to end every Monday Morning Minute talking about our Disney course on August 6th and 7th and our Nashville course on the 24th and 25th of September. Our Disney course is filling up nicely. We do have a few seats left, so remember, 50% off. Take advantage of that. Come down to Disney, and the course will be absolutely phenomenal. Believe me. Same with Nashville. Come to Nashville for our International Academy of Mini Dental Implants meeting. I guarantee that it'll be 2 of the best educational days in mini dental implants that you've ever had in your life. Take advantage of it. Come see us, and we hope you have a great week placing those mini implants. If you have any questions, don't ever hesitate to call Shatkin F.I.R.S.T at 1-888-4-SHATKIN, or you can visit us online at shatkinfirst.com. Have a great day.